My name is Dr. Kristen Killian. I am one of the Advanced Clinical Education Specialists here at UPMC St. Margaret. I wish I could actually be there in person with you guys, but we accidentally went to the wrong campus. So your team was kind enough to allow us to record our presentation to share with you guys as well. I understand it's getting to be close to the end of your semester. So I wish you all a happy summer break if you have one, or if you're continuing on, I wish you a happy next session. But the purpose of what we're here to talk about today is to promote National Donate Life Month. So every April is CORE's National Donate Life Month, which basically stresses the importance of organ donation and bringing awareness to this important topic. Working in a hospital, this is a super huge passion of ours. I am the educator along with my colleagues Morgan Orr and Nikki Corrado. We are all ICU step-down trained, and we all support those units, and these tend to see are most cases of organ donation, but we think it's really important too, as you're going through your clinicals, to at least have a brief understanding of why we want to bring awareness to this topic. If you have any questions following this presentation, feel free to reach out to your team. They have my contact information, and I'm happy to connect with any of you guys if you want to know more information. So let me share my screen with you. Okay, so again, the core team here at UPMC St. Margaret is myself, Nikki Corrado, who is one of our clinicians in the resource department with a focus on critical care, and then Morgan Yamber is our clinician that focuses on education for our ICU and our step-down unit. So what exactly is CORE? CORE stands for the Center for Organ Recovery and Education. It is actually it is a subset of the organ procurement organizations. There's actually 58 of them within the United States. CORE is probably the one that you've heard of the most. It's probably one of the bigger ones, and it's our service region includes all of Pennsylvania, West Virginia, and New York. Somebody actually did tell me out at West when they were traveling, CORE actually exists in some of the Western states as well. But it is federally regulated, and it's a non-for-profit company. But I think this last statistic is probably the most mind-boggling, but on average about 20 people die each day while waiting for a transplant. So this is super important. We want to know why people are waiting, kind of break down some of the common myths here. Again, why do we care? Why is this important? So approximately every 10 minutes, someone is added to the transplant waiting list. If you think about this presentation is going to be just about under 10 minutes. So by the end of this presentation, somebody else will need to go on the list. For Pennsylvania, about 7,400 Pennsylvanians are currently waiting for a life-saving transplant. And then this one is kind of mind-boggling as well. 97% say that they support organ donation, yet only half of those are registered as a donor. So we're going to find out why a little bit. But there are currently 8 million Pennsylvanians eligible to register, which basically shows that we have a lot of educational opportunities here to see if we can up the number of people that actually do follow through with registering to be an organ donor. This is probably one of my favorite slides, because when we do education and we do promotion for Donate Life Month, we compiled a list of the most common myths that we hear frequently. Probably the biggest one: I can only sign up when I renew my license. That is not true. You can sign up lots of different ways. I'm too old. At UPMC St. Margaret, we do have a very elderly population when it comes to our patients and just our visitors, and we hear this very frequently. CORE does not have any age restrictions to become a donor. Another one that we hear sometimes is I have a medical illness, or I have a predisposing condition that they wouldn't want my organs. That is also not true. There's quite a few, there's very few illnesses and conditions that would prevent somebody from becoming a donor. Another one, sometimes it's against my religion. We'll explore that on the next slide as well, but actually some of the largest religions globally actually support organ donation and find it to be an interesting, they're very supportive of it. And then this one too, we do laugh at this one. Our ER hears this a lot: they won't work to save me if they know I'm an organ donor. That is naturally not true. Of course, life-sustaining measures will be used regardless of your donor status or not. So let's talk about the first one there, that I can only register to be an organ donor when I renew my license. You actually have multiple different ways. You can do it from your phone. You can register with Donate Life. That we have pamphlets that we give out. You can actually just go to registerme.org, organdonor.gov, donatelife.net. There's so many different ways. You don't have to wait until you renew your license. Now, of course, that is one of the ways if you want to add that on when you do renew, but there's multiple different ways, and it's so easy to register. Again, there's no age limit for donation. It doesn't matter how old you are, how young you are. There's no age limit. Again, very few illnesses or conditions prevent people from becoming an organ donor. There's virtually nothing that would be excluded from that. Again, all major religions consider donation to be an individual decision or support it as a final act of love or generosity towards others. And then, of course, the number one priority is to save your life. CORE is only actually notified after everything else has failed. So they don't not try to save you if they know you're an organ donor. So again, this is St. Margaret figures. So this is technically only for our hospital, but might find it interesting as you guys go about your clinical experiences to ask. So we are a community hospital. We have about 250 beds. We very rarely are that full. But so for 2020, again, the year of the pandemic, so we actually had 250 required death referrals here at St. Margaret, and 249 of them were actually made to CORE, which is a really, really great number. Our staff did a really good job of making sure that CORE was notified for all of the required death referrals. For CORE, they require that the referral is made within an hour of death, and we had 240 out of 249, which, again, looking at an overall big picture, only having 9 cases where that was not the case when there was a pandemic going on is truly remarkable. We did have 1 late or missed organ referral. That was one that was just missed from our standpoint. The patient must remain intubated prior to the referral. So this was one of our huge 2020 educational opportunities, because we did have 2 patients that were extubated prior to calling CORE and making the referral. But once they're extubated, they lose the opportunity to be an organ donor. They have to be intubated. And then this is another opportunity that sometimes we miss out on from both a nursing standpoint and a physician standpoint, approaching the family. So CORE prefers for them to approach the family, and we are not to discuss CORE with the families, just because in terms of the education, we don't want to be saying anything that we shouldn't be saying. So we kind of use this as an opportunity to educate our staff. CORE is going to be the one that is responsible, because if we approach the family, that can knock them out of being an eligible donor. So out of a potential 11 tissue donors, this tends to be St. Margaret sees more tissue and eye donors than they do organs. Out of a potential 11, we had 8 actual tissue donors for the year of 2020. Out of 10 potential eye donors, we had 8 actual, and we did not have any potential or actual organ donors for 2020. But again, really good numbers for here at St. Margaret. So that covers that. So again, we were coming out to you guys as you go into your clinical experiences to kind of ask questions about organ donation, see if the staff can speak to it, kind of dispel some of the common myths. We are currently doing this hospital-based challenge to try and get to the highest status that we can, our journey to titanium status, which includes actually reaching out to academic programs, because the more you hear about it, the more you're going to feel comfortable when it comes to taking care of your patients, especially if you enter into a demographic of patients that you would have to interact with CORE. Again, thank you so much for your time. Really appreciate you allowing us to come present to you. And if there's any questions, please don't hesitate to ask your professors. They know how to get in touch with us. Take care. Have a good night. It's 8 o'clock in the morning here when I'm recording this. So have a good day. Have a good night whenever you're watching this, and happy Donate Life Month. Take care.